really appreciate your attending today and look forward to your questions as well. So um, on the next slide, I'll just introduce PFCC Partners as an organization with a mission and vision to transform the healthcare system through partnership with people with lived experience. And I started Patient Family Centered Care Partners in 2010 as a result of my own lived experience, first caring for my mother while she battled breast cancer. And then shortly after she passed away, had three boys who live with mitochondrial dysfunction. And then in 2016, my own journey with stage 4 salivary gland cancer. And that's what we're really about, bringing all of those perspectives to partner with all of you to create the improvements we both want to see in the healthcare system. So on the next slide, we know healthcare is super complex. There are so many systems to navigate. Jen Wagner and I were just commenting about everybody being at Quality Conference in Baltimore and how that's just such a massive system and sometimes seems a little disconnected with what's going on in our hospitals on the ground. So we know there's a lot of complexities. There's primary care, there's hospital systems, there's rural health, and it makes it difficult to navigate and really even tougher to change. But I think through partnering with all of us together, we can really achieve some of those changes we want to see. So PFCC Partners then is about opening the space in the healthcare system so that patients and families can, with lived experience like myself, can inform our quality improvement. So maybe that looks like, gosh, I felt like I knew something was going wrong before my loved one got sepsis. And I was able to talk to my nurse, and the nurse responded, and we avoided a catastrophic outcome. And so it's really about bringing those lived experiences in to help partner to create the safety and quality we want. And then as part of the PFA network, as part of PFCC Partners, rather, once we open this space, we then bring in all kinds of people that participate in our PFA network. That's over 1,000 people like myself, patients and families with lived experience that are ready, willing, able, prepared to partner with quality and safety initiatives, in addition to research entities and measure developments and CMS as well. So PFCC Partners opens the space, the PFA network fills it then. All right, so what are we doing when we're filling it? Well, I always like to start with some definitions just to make sure we're all in the same conversation. And at PFCC Partners, we are pretty simple. So you can look for much better and more expansive definitions. But to keep us on the same page in the conversation today, I'll just share that we look at person-centered care as the noun. It's the model of care that we're all trying to build. If that's the case, then patient-family engagement is the verb. It's the active strategy of bringing in insights and having those insights inform the quality improvement packages that we're designing. And so if patient-family engagement is a verb, it's a strategy. It can be applied to whatever you're trying to improve. So it might be a patient safety outcome that you're trying to improve. It might be reducing hospital-acquired infections. It might be improving those pesky HCAP scores. But the strategy, the active part, can be applied to produce better outcomes no matter what your goals. And I just want to kind of decouple the concepts of patient-family engagement and patient experience. Patient-family engagement, again, is that active strategy. Patient experience is an outcome. So while you might use patient-family engagement to achieve better outcomes in patient experience, it's not the same thing. And what happens is sometimes hospitals think about patient-family engagement as patient experience work, and then it sort of gets siloed over there in that patient experience work, and it's hard to bring it out into other quality and safety initiatives as well. That's why I'm so excited. I'm always so excited to talk to quality folks because you really have the opportunity to leverage patient-family engagement to create the outcomes you need to see in your hospitals. All right, on the next slide. So we're simple and we also like to have fun. And so our Chief Operating Officer Stephen Hoy, who happens to be my oldest son, um, came up with this analogy of the funfetti approach to partnership. And what it means is that if you've ever had a delicious funfetti cake, you know that all the flavors are baked into each layer, right? So patient family engagement is baked into to the caregiving relationship so that we're engaging our patients and their family caregivers into care planning and bedside rounding and the like. But it's also embedded and baked into quality improvement initiatives, to hospital operations, and even moving up the layers into CMS policymaking. So patient family engagement is baked in across the layers of the health system. And by the way, what makes a funfetti cake really good is all the different colors and all the different flavors, right? So patient family engagement is uh, intersects constantly and is part of can be a strategy for building an equitable health system. The more diversity we have, the better information that we have. All right, so moving on from the funfetti approach, and as I was talking about patient family engagement, we really go with patient family engagement for equity now. And so, what does that mean? That can feel like a really heavy lift. Like, and I know, 5 years ago we used to say, "Hey, start a patient family advisory council and make sure that your council reflects the diversity of your community." And then we sort of walked away. And it didn't really help with how to do that. But we've learned so much in the last 3 years, thanks to our DEI Leadership Council and other efforts about how to really create inclusion. And so for us, by focusing on inclusion, we can then engage more diverse folks. So what does that mean? It means thinking differently about, yes, a patient family advisory council, but maybe that's not the right place for your organization to start. And thinking about some of these, breadcrumb steps allow for more diversity. You can imagine if you have a PFAC that meets on an evening once a month, that's really hard for a single mom to attend or to participate in. But maybe that mom could participate in community conversations or a short-term quality improvement project. And so thinking differently and thinking about inclusion really helps us to build equitable outcomes. All right. So here's an example I just wanted to share with you. Um, and this is some work that we did with the Convergence team and the HQuick. So I think every hospital in the country is working on reducing readmissions, at least all the ones that I'm speaking with. So how can we engage patients and families in that process? Well, your patient family partners can talk about their discharge experience and identify, in this case, identified the timing of instructions as an obstacle more so than what the instructions said. So the hospital was very focused on patient education and how do we give the right information. And as it turned out, in this hospital for these patients, it wasn't so much a case of the information not being effective, but it was when it was given that really kind of took them out of the process of absorbing that information. So together, patient family partners can work with the interdisciplinary team to design a discharge process that improves outcomes, especially ones that are meaningful to patients and families, and really avoid those trips back. And from this body of work, we were able to develop with the Convergence patient family partners a wonderful tool called Ready, Set, Go, and an accompanying patient journey map. And those tools really, again, we started with a concept of what else do we need to know from the patient perspective about readmissions, and we then took that what we learned to the staff and what did they know about the hospital readmissions, and began to design together and reiterate together these tools so that when we produce a tool, we know because we've had the input from patients and families and from the healthcare staff in this partnership, we know that those tools are going to be effective, but they're also going to be feasible in the context of the hospital environment. All right, on the next slide then, as we start to think about, oh, that's a little bit small, isn't it? I'm sorry. but you'll get these slides afterwards, I'm certain. This is a newer table that our team designed to help organizations who are maybe just starting with patient-family engagement for equity, or maybe they've been doing it, but they want to take on the funfetti approach, to really help think about what is available in terms of resource in your environment, in your specific hospital, because we recognize if you've been in one hospital, you've been in one hospital. And if you've been in one rural health hospital, you've really only been in one hospital. So really important to think about what are the resources. And so we kind of put this together to let hospitals know and sort of unburden you all from the concept that you have to create a patient family advisory council now. It is a great format, and if you have the ability to do that, I would encourage you to do that. But if you're at a smaller hospital, or this is new, take some steps. You can do a survey. You know, recruitment for surveys is pretty straightforward. It's a low level of commitment for the patient family partner and for the staff, and so that can give you some insights. It's not quite as dynamic, right, as a strategy, but it gives you important insights. Interviews can come. Oh, thanks, Jen. um, Interviews can be really helpful in getting a little piece of that dynamic. You know, being able to ask a question or a follow-up question. Of course, the limitation is that you're getting just the experience of that one patient. So maybe you want to hold a focus group. So if you have a survey and you see some themes bubble up, and then you have an interview and you really explore that with one patient. Maybe you have a focus group to dive very deeply into that concept or that trend that's bubbling up for you. So that's how you can use these in succession, or there's no right place to start. There's just start. The difference between a focus group and a listening session, we get that a lot. For our team, we look at a focus group in terms of a very singular topic, and we have maybe 6 to 8 folks in that focus group, and we ask the same question of all 6 to 8, so we get a deeper dive on that topic. In a listening session, we'll broaden that to maybe up to 12 folks, and we'll just throw a concept out there. You know, what do you think the problem with readmissions is? And we'll allow people just to respond, to interact. You know, if somebody says something that lights somebody else's fuse, we want to hear from that. So it's a little bit more dynamic, but it gives us a broader sense of the issue. And so sometimes those are really helpful if you're thinking, wow, this is a real starting point, and I'm not sure if I am thinking about this problem in the right way. Let me give you an example. Well, the example I gave you in terms of the timing of the discharge information, a listening session might say, how did you get the information for the discharge? And that would naturally bubble up. So maybe, I'm not explaining this right. Maybe you're thinking that the problem is the language or the literacy level. And a listening session can help you identify other items that might be influencing the outcome that you hadn't already thought about. So the focus group, you already have those thoughts that you're wanting to explore. In a listening session, it's a breadth of information that may get you thinking about components that you hadn't previously been. Engaging patients and families at least 2 at a time onto a quality initiative, directly into the quality initiative. There's a little bit more preparation that goes on with that kind of an activity. It's a little heavier lift for the patient family partner and a higher lift for the staff, but for that short duration of the quality initiative. So thinking about that from start to finish, the key about engaging patients and families into quality initiatives is starting at the start, bringing them in at the start, not once you clean everything up and you think you know where you're going, but bring them into the mess and let them help, sort of help you navigate to get to the North Star. A quality committee, a standing committee, again, this would take some more preparation. This would take maybe some accommodation. If you have middle of the day meetings, you might need to offer a virtual mode. If you have English as a second language community members, you may need to offer translation. So that's going to require a little bit higher lift of the staff. It's also going to require a higher lift of the patient family partner in terms of preparing for those meetings ahead of time. And then a patient family partnership council. So again, you could pick and choose these items. There is no wrong order, really just thinking about what your organization has available to help move this work forward. All right, on the next slide, I just wanted to leave you with an important message. Regardless of what activity you decide to use and to implement as a PFE strategy, think about the infrastructure. That's the biggest misstep I see with hospitals and health systems is that they are so eager, and it comes from the best of places, but they're so eager to hear from their patient family partners that they sort of skip to that piece and forget to do the front end work of really thinking about what does this work look like for the hospital? Is this a small test of change that we're going to start doing this, or is this a bigger initiative at our hospital? How is it tied to leadership? Where is the communication? And then how do we prepare patient and family partners for this active role with us? Because that preparation piece is important as well. And then preparing and facilitating that partnership in a way that really positions the hospital as a trustworthy organization. So I want to relieve you of the need to make patients and families trust you. Instead, focus on being a trustworthy organization. And what that looks like is being consistent in your communications, following through, things like that. So really thinking about how you facilitate trustworthiness. And then sustainability practices. How are you going to sustain? Are you going to do a PDSA so that you understand what you've learned from this partnership and then can continue to modify and improve even the partnership itself? That's something I've been at this for 25 years, and I'm still trying to improve it because we're always learning, we're always moving forward. So just a word to infrastructure. And the Gateways program is a program of PFCC partners, but whether you use something like this or whether you just think about it for your own organization and make sure you have a good communication loop, a good preparation plan, and a solid tie to leadership, and you'll be in great shape. So that's just a smidge, but PFCC Partners is here and available to be a support to you as you're thinking about it and moving forward with patient family engagement. The PFA network is a resource to you as well. So happy to be on this journey with you.